Good evening, everyone, and welcome to this year's infographic webinar on the topic COVID-19. I am Silent Bakatan, your MC and moderator for this evening's event. So before anything else, I would like to acknowledge the presence of our dear participants coming from Barangay Talamban, Cebu City. If your names are called, can you wave to be recognized? First, we have the Barangay Health Nurses, Ms. Rihanna Roddy and Ms. Resmel Castel. Then the Barangay Health Physician, Dr. Sarah Gumbe. Then the Barangay Captain, Mary Grace Yu. And our SK Chairman, Ms. Flora Lynn Pontrivida. Thank you all very much for participating in this webinar. So the program will be as follows. After my part will be the presentation by our dear guests from DOH National Head Office, Infectious Disease Director, Dr. Nicole Burgos, and DOH Region 7 Secretary, Dr. Roslyn Medallo. A short open forum discussion will then follow. So without further ado, let's give our undivided attention to Dr. Nicole Burgos. Take it away, Doc.
Good evening, everybody. I will be giving a short talk on COVID-19 pandemic. What is COVID-19? COVID-19 is an infectious disease caused by the coronavirus, specifically SARS-CoV-2. The outbreak originated in Wuhan, China on December 2019. What are the most common symptoms of COVID-19? They include tiredness, high fever that exceeds 37.3 degrees Celsius, dry, unproductive cough, and in severe cases, difficulty breathing. The least common symptoms of COVID-19 include body aches and pains, nasal congestion, runny nose, lost sense of smell and taste, sore throat, and diarrhea. What are the complications of this virus? For most people who are infected with the virus, they have mild to moderate symptoms. However, older adults and those with existing chronic medical conditions tend to have severe medical complications with this virus and can even lead to death. Complications include pneumonia and trouble breathing, organ failure, heart problems, severe lung conditions in which blood clots form, acute kidney injury, and because the individual is already immunocompromised, they can have additional viral or bacterial infections on top of COVID. What is the mode of transmission for this virus? The virus is transmitted from person to person via droplets, contact, and fomites. When an individual talks, sneezes, or coughs, they produce aerosol droplets of saliva containing the virus. These droplets are inhaled by the nearest person. Transmission also occurs among close contacts, so family members living under one roof, all in the same roof, and healthcare workers. Incubation period. What is the incubation period? This is the time between the exposure of the virus and the first appearance of the symptoms. The World Health Organization says that the incubation period of this virus ranges from 1 to 12.5 days. The World Health also recommends that you monitor your symptoms and your contacts for 14 days to be in the safe zone. We will be talking about preventative measures. So how can you protect yourself and prevent the spread of the disease? You want to practice frequent and proper hand washing using soap and water, or use alcohol-based sanitizer. You want to maintain social distancing of at least 1 to 2 meters away or 3 to 6 feet away from individuals. You want to avoid touching your eyes, nose, and mouth, as the virus can enter through mucous membranes. You want to cover your mouth and nose when you sneeze or you cough. You want to seek medical attention if you have difficulty breathing and high fever. On top of all of this, you also want to follow the instructions of national and local health authorities. And what do I do if I'm sick? Stay at home as much as you can. Quarantine yourself from other family members and from the public. You want to monitor your symptoms for at least 14 days. You want to wear a mask over your nose and mouth. Clean your hands and highly touched surfaces often. If symptoms are severe, if you experience difficulty breathing and high fever, you want to seek medical attention as soon as possible. Lastly, be truthful to the medical staff about your recent travels. Here we have an image of someone demonstrating the proper use of a face shield and a face mask. As you can see in this lateral view, she has her face mask covering her nose and her mouth, and she also has the face shield to cover her eyes. Here we have worshipers practicing social distancing. You can see that they are at least a meter or so apart from one another. And that is the end of my presentation.
Thank you very much, Doc, for that very informative talk. Now it's time for the open forum. We have actually gathered your questions ahead, and I'll ask Dr. Medallo, the DOH Region 7 Secretary, to answer them for you. Doc Medallo?
Yes, I have here some questions from our viewers and I'll address them now. We have here a barangay health doctor, Dr. Sarah Gombe. She asked if what is the view on the use of public transportation. Actually, we from the Department of Health, we have an administrative order number 2020-0015, the national and the active modes of transportation that are promoted are the use of bicycles, walking, and other forms of light mobility transport. The national and local governments have also been advised to build or renovate bicycle lanes and walking paths to facilitate this order. Our goal for this is to provide guidance for the promotion and safe use of active transport during and after COVID-19. We have here a second question from the SK chairman, Ms. Flora. She asked if how long does the virus survive on surfaces? According to the World Health Organization, there is still no confirmed timeline of how long a COVID-19 virus would survive. But it is like the other coronaviruses wherein study shows that they can survive on surfaces for a few hours or up to several days, depending on varied conditions such as the type of surface, the temperature, or the humidity of the environment. And the third question is from a barangay nurse, Miss Rihanna. She asked if are there any travel restrictions to be observed. Travel restrictions are volatile and can change periodically as the new developments emerge. These restrictions are decided by the IATF or the Interagency Task Force on Emerging Infectious Diseases based on a risk assessment for the current situation. As such, just keep updated to our DOH dedicated webpage on COVID-19 and also on our Facebook official account and Twitter accounts for the latest information. And we have here, second to the last question from the barangay captain, Miss Mary. She asked if what should I do if I have had close contact with someone who has COVID-19. You should always be alert for symptoms, especially fever, cough, shortness of breath, and other symptoms of COVID-19. You must also take your temperature and follow the CDC guidelines for your symptoms. And last question from a barangay nurse, Miss Rosmel. She asked if should I use soap and water or hand sanitizer to protect against COVID-19. Hand washing is one of the best ways to protect yourself and your family from getting sick. You must wash your hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, going to the bathroom, and before eating or preparing the food. And if soap and water are not readily available, you may use alcohol-based hand sanitizer with at least 60% alcohol. So I hope that this answers your questions.
Thank you very much, Doc Medallo, for that information. And that ends this evening's webinar. So I hope you have learned a lot. If you have any more questions, suggestions, and comments, you can contact them directly through their landline or through their website. Also, please be updated for the latest information on COVID on the DOH official website. So thank you very much for coming. Good evening.